Welcome to The Explainer. Today we're diving into a question that seems simple on the surface, but is actually, well, it's incredibly complex. When someone gets sick, what's the true cost? We're going to break down how experts calculate that number, and I think you'll be surprised to find out it's way, way more than just a medical bill.
All right, let's start with something we all know, right? The flu. You get a nasty case of it, you probably think the cost is just, a trip to the doctor and maybe some medicine from the pharmacy. But what about the day of work you had to miss? Or the gas money it took to drive to that pharmacy? What if your partner had to stay home from their job to take care of you? All of a sudden, that simple flu doesn't seem so simple anymore.
And that right there, that's the key idea. The number you see printed on a hospital bill is just the tip of a very, very big iceberg. To really understand the full impact of any illness, whether it's on one person, a family, or an entire country, you have to look much, much deeper.
And to do that, we need to make a pretty big shift in our thinking. We need to stop thinking like an accountant and start thinking like an economist. It's a completely different way of looking at what something is worth.
So check this out. An accountant looks at the accounting cost. That's the number on the receipt. It's what you literally paid. But an economist sees the economic cost, and that includes not just what you paid, but the value of everything you had to sacrifice because you were sick. It's the huge difference between what you pay and what you give up.
Now this big idea, it has a name, opportunity cost. And honestly, if you take one thing away from our time here today, this is it. The opportunity cost of being sick is the value of whatever you could have been doing if you were healthy. That could be your job, sure, but it could also be taking care of your kids, volunteering, or even just enjoying your free time. Every single hour you spend dealing with an illness is an hour you didn't spend on something else, and that is a cost.
So you might be wondering, who's actually footing the bill for all this? Well, it really depends on your point of view. You've got the patient, the hospital or doctor, and the insurance company or the government. But the biggest, most complete view, the one we're focused on, is the societal perspective. It's the one that basically bundles all the other costs together and then adds in all those hidden costs that nobody ever gets a bill for.
Okay, so if we're trying to add up all these different sacrifices from that big societal point of view, it could get messy pretty fast, right? Well, thankfully, experts have a system. They sort everything into three main buckets to keep it all organized.
And here they are: direct medical, direct non-medical, and indirect costs. It's a simple framework, but it's really powerful for seeing the whole picture clearly.
So let's break down what goes in each bucket. First, direct medical costs. This is the obvious stuff: the doctor's visit, the hospital stay, the prescriptions. Then you have direct non-medical costs. These are other things you pay for out of pocket, like gas to get to your appointments or maybe special foods you have to eat. And then there's the big one: indirect costs. This is the value of all that lost productivity, the money you couldn't earn because you were sick.
Buried inside those non-medical costs is this absolutely huge and often totally invisible factor: informal care. This is the time your spouse takes off work to drive you to a chemo appointment. It's your friend who helps you around the house while you recover from surgery. No money ever changes hands, so it never shows up on a bill. But for an economist, all of that lost time is a very, very real opportunity cost for society.
Okay, let's get into the next piece of this, because this is where it gets really tricky. It's one thing to say, okay, lost work time is a cost. It's a whole other thing to put an exact dollar amount on it.
Seriously, how do you do it? If a high-powered CEO and a college student both miss a week of their usual activities because they have the flu, is the cost to society the same? Well, economists actually debate the best way to calculate this, and it really boils down to two main approaches.
Let's break this down. First, you have the human capital approach. This one is used most often. It calculates the total potential loss. It basically says if a worker is out sick, their economic output is just gone, lost to society. It assumes their job just sits empty. But then you have the friction cost method. This one tries to measure the actual loss. It argues, hey, hold on a second. In a real economy with unemployment, if someone is out for a long time, their job doesn't just stay vacant. Someone else gets hired. So the real cost to society is only the production loss during that friction period, the time it takes to find and train a replacement.
So the bottom line is this: the human capital method gets used more often, probably because it's just simpler to calculate. But a lot of experts will tell you the friction cost method is more realistic, it's closer to what actually happens.
And choosing between them isn't just some academic exercise, it can lead to wildly different estimates for the exact same illness.
And that brings us to our final and maybe most important point. Why does all this detail matter? I mean, who cares which method you use? Well, it matters a lot, because these numbers are used to make massive, sometimes even life-or-death policy decisions.
Look at it this way. If one study calculates the cost of diabetes using one method, and another study calculates the cost of heart disease using a totally different one, how can a government possibly decide where to invest its public health budget? You can't. You're comparing apples and oranges. That's why creating a standard rulebook for how to calculate these costs is so crucial. It lets you make fair comparisons, which helps policymakers set priorities and, hopefully, spend our money in a way that helps the most people.
And this quote from the source material really just nails it. Standardization is pivotal. Without it, all this data is just noise. But with it, the data becomes this incredibly powerful tool that we can use to build better, more efficient, and fairer health systems for everyone. So, as you can see, understanding the true total cost of an illness, from the hospital bill all the way to lost productivity, is the essential first step. But it leaves us with an even bigger question. Once we know that number, what do we do about it? It really forces us to ask ourselves as a society, what are we actually willing to pay for a healthier future? And that's a question worth thinking about. Thanks for joining us.